Hello, Lambert University family. My name is Dr. Tanya Lambert. I'm a women's health educator and advocate. I like to give my disclaimer. The content that I provide in any of my videos is strictly educational and informational. The content that I provide is not to be used to diagnose, treat, or cure any disease. Continue to speak with your licensed healthcare provider regarding your health questions, needs, and decisions. All right, let's get into this exciting topic. Hello, everyone, and welcome to Lambert University. My name is Dr. Tanya Lambert, and on this channel, I share information to help women with fibroids to be empowered to make healthy decisions to improve their health. Now, many of you have been asking me about my journey with fibroids, and I must tell you, it was a long and challenging one. Maybe not as long as some other women, but certainly it felt like a pretty long journey for me. Now, you probably saw by the thumbnail that I referenced that I took 98 birth control pills in 1 week. And as many of you already know, that a lot of women with fibroids, especially heavy bleeding, are prescribed birth control pills to control the bleeding. But many women also hear that birth control pills can potentially contribute to fibroid growth. And the question is it true? In this video, we are going to explore how birth control pills can potentially contribute to the growth of fibroids. But before I get into it, I want to share with you how I ended up taking 98 birth control pills in the first place. So I started having heavy menstrual bleeding during my second year of medical school. Originally, my menstrual periods were about 7 days in length. But then I started noticing that my period started getting heavier and it was lasting for a longer period of time. So first it was 7 days, but then one cycle I noticed it was 8 days. And then after that, it became 9 days. Then the next cycle was 10 days and then eventually 2 weeks. And then it continued nearly nonstop for 2 years. The bleeding got so bad to the point that one time when I was on my surgical rotation, I started feeling incredibly dizzy and was nearly about to pass out in the operating room. But before I would even let that happen, I spoke with my attending and said to him, "Can I get a break to go to the ER? I'm feeling very lightheaded." And he said, "Sure." So I took my leave and I asked someone to accompany me to the emergency room. The next thing I knew, I was given 3 blood transfusions and 2 doses of IV estrogen. After being discharged from the emergency room, the bleeding still didn't completely stop. So I went to my OBGYN, who then prescribed 98 birth control pills for me to be taken over a period of 10 days. So that was about 8 pills per day to start, and then I had to taper it down to 4 pills per day. So it was an intense ordeal just getting those pills into my body. And then I noticed that the bleeding was starting to subside or reduce even more, but it didn't completely stop. So then I went back to my OBGYN again and told her what was going on. And then she suggested that I had a shot of Depo-Provera. Depo-Provera is also known as the birth control shot, which you only take once every 3 months to shut down your period and prevent ovulation. So I also took a shot of the Depo-Provera as well. And then a few days later, the bleeding completely stopped. Now, I was grateful, but I was very concerned that I took all of that hormonal therapy to stop the intense bleeding. Now, the story gets even more interesting because a few days later, I was sitting in my room studying for one of my exams when I noticed a interesting sensation in my lower abdomen. Literally, I felt a mass move from my pelvic region into my vagina. I was very confused and shocked, and I ran to my bathroom and decided to check and see. And lo and behold, I saw basically a massive tissue protruding out of my vagina, and I was concerned as to what it could be. I thought for a split second that my uterus could have prolapsed, but I didn't really have any of the risk factors for a uterine prolapse. So then I decided to go back to the emergency room again to figure out what it was. Now, in the emergency room, I was seen by a male physician, which I was a little bit uncomfortable with given the situation. But at the time, I didn't really know if I had a choice in the matter, so I just continued to allow the physician to examine me at the time. But what I noticed with that physician was that he wasn't really interested in examining me. In fact, he felt uncomfortable with examining me as well and barely even took a look at what was going on. He then misdiagnosed me and said that I had a bladder prolapse. So at the time, I thought my bladder had prolapse, and then I was referred to go back to my OBGYN, who then, when she was examining me, noticed that one of my fibroids had prolapsed into my vagina. It was hanging on the outside by a stalk. So while she's explaining it to me, what was going on with my body, she then proceeds to twist the fibroid as if she was trying to yank it off. All I remember her saying was, I see it, and started twisting it without even telling me what she was doing. I then started screaming out in pain because I didn't really understand that she was actually trying to remove the fibroid. But the problem was she didn't actually inform me that she was going to do that, and I wasn't even given any pain medication. So it was incredibly painful. Fortunately, she didn't remove the fibroid. She then stopped what she was doing and said, you know what? We need to bring you into the OR immediately and have the fibroids removed. Now, of course, she allowed me to schedule a time for me to have the fibroids removed by a procedure called a myomectomy. But I was just incredibly confused and in a lot of pain while she was explaining to me what the next steps would be. And at that point, I was incredibly frustrated because of what I just went through in the ER and then what I just went through in my OBGYN's office. And so I decided to schedule my appointment to have the fibroids removed by myomectomy in 3 days from that time, and I left her office. Now, when I got to my car, I just sat in my car writhing in pain for at least an hour, trying to process what actually just took place here. And I decided to call up one of my aunts who is a registered nurse. And when she heard the story, she said, you know what? You need to get a second opinion. And she put me in touch with another one of her friends who's also a registered nurse, who was so gracious to say, you need to get a second opinion, and then referred me to one of her preferred OBGYNs in the same state. So then after getting that information, I decided to schedule an appointment with the OBGYN that was recommended to me by my aunt's friend. And honestly, it was the best decision I ever made for myself and my health. Because when I went to that OBGYN, she took a good look at my MRI reports and saw that if she were to bring me to the OR to remove the tumors by a myomectomy, that I had another issue called adenomyosis that would have caused me to bleed out on the table and potentially have a hysterectomy. She said to me, if I take you to the OR, what's likely going to happen is you're going to bleed out uncontrollably and I'm just going to have to remove your uterus. And I don't want to do that to you. And so she said to me that she was going to refer me for another procedure called the uterine fibroid embolization. And so I decided to see an interventional radiologist that she recommended to do that procedure. And I ended up having to get the UFE. And personally, for me, it was the best decision that I made for myself, because that, coupled with changing my diet and lifestyle and being very intentional about it, along with the procedure, actually helped me to shrink the fibroids even more rapidly. Because then when I went back to my physician, about 6 months later, he was shocked and amazed to see how well I did with the procedure. Now, I will talk to you more about what the UFB is and the benefits of that in a later video, but I just want to share with you how I ended up taking 98 birth control pills and why I did. Now, let's talk a little bit about birth control pills and how they actually do contribute to the growth of fibroid tumors. So I hope you are enjoying the content of this video, but because the content is pretty long, I decided to break it up into 2 parts to make it easier for you to get all of the information. So in the next video, I will be sharing with you the side effects of birth control pills, also known as oral contraceptive pills, how they can contribute to the growth of fibroids, as well as how they can potentially harm your organs, such as the thyroid gland and your gut health. I will be dropping this video this Wednesday at 10 a.m. Pacific Standard Time. So the goal of my channel is to share high quality research-based information with women who have uterine fibroids, with women who have suffered previously from uterine fibroids and are looking for practical methods of prevention, and also with people who know of women who are suffering from fibroids who want to know what their options are. Now, I was once in your shoes where I used to suffer from severe uterine fibroids, and I have an understanding and a background in the medical side as well as the natural side. So if there are any topics that you're interested in learning more about as it relates to uterine fibroids, drop it in the comments below. And if you like the content of this video and my other videos, give this video a thumbs up, share it with your loved ones, and don't forget to subscribe to the channel. I look forward to seeing you in the next video. Take care of yourselves and God bless.